Hello and welcome back to Reality Binge. What are the most common causes of death in the world? Heart disease, cancer, and stroke are some of the biggest, but the answer to this question may not be what you think. This may seem like a simple question, but it can be difficult to answer. The world population is increasing, and human beings are able to sustain longer lifespans. This increases the number of people who are susceptible to various diseases and illnesses. It is estimated that there will be an increase in deaths from infectious diseases, cancers, cardiovascular diseases, diabetes mellitus type 2, and Alzheimer's disease. So in this video we will discuss the top leading causes of death in the world and which is the most common to look out for. It may not be what you think. Neonatal conditions. The fifth most leading cause of death in the world is neonatal conditions. This includes birth trauma, respiratory distress syndrome, and sepsis. The neonatal conditions are the leading cause of death in South Asia and Africa. This is an alarming statistic because it's something that could be avoided easily with access to prenatal care, which is vital to make sure the mother and child are healthy before birth. Lower respiratory infections. The fourth most leading cause of death is lower respiratory infections. This is more common in Africa and Southeast Asia than other places. The leading cause of death in this category is pneumonia, which can be prevented with vaccinations. Lower respiratory infections usually occur when people live in unsanitary conditions, smoke, or there is overcrowding. This category of death has a lot to do with the environment you are living in and is preventable. Lower respiratory infections affect mostly babies because they don't have antibodies yet, which can help them fight off these types of illnesses. Sometimes when pregnant mothers get sick, their baby will too if it is young enough. This can also happen even if the mother was vaccinated for pneumonia before she got pregnant, but this should not discourage women from getting vaccines while pregnant, since they are still much safer than risks taken during pregnancy without one. Chronic obstructive pulmonary disease. The third most leading cause of death in the world is chronic obstructive pulmonary disease. China has the world's highest COPD mortality rate. It is estimated that by 2030, COPD will be the third leading cause of death in developed countries due to rapid aging and ongoing smoking rates. Heart disease affects a lot of people every day because there are many risk factors for heart disease, like if you smoke or have high blood pressure. The most common type of this illness is coronary heart disease, which can happen when plaque builds up in your arteries, which makes it hard for blood flow to go through them. Stroke. The second most leading cause of death in the world is a stroke. Stroke is a medical condition where the blood supply to part of your brain stops and causes damage. There are two main types: ischemic stroke, which happens when an artery that brings oxygen-rich blood to the brain becomes blocked by embolism, narrowing, or rupturing, and hemorrhagic stroke, which occurs due to bleeding in or around the brain. People that are most likely to have a stroke are those that have high blood pressure or people who smoke. Ischemic heart disease. And finally, we come to the first on our list of the most common causes of death in the world. Ischemic heart disease. Ischemic heart disease is a condition that happens when the arteries to your heart become narrowed and cuts down on blood flow. Usually this occurs because of atherosclerosis, or plaque buildup in the artery walls, but there are other factors such as high levels of cholesterol. Heart disease is currently ranked as number 1 out of all causes of death globally, with about 17 million people dying each year due to it. So what are some things we can do to avoid heart disease and some of these other common causes of death? Well, it's important to stay active and not give up on physical activity. You should also monitor how much alcohol and caffeine you consume, because they both have been shown to increase blood pressure levels and are linked with cardiovascular problems and if you smoke cigarettes or marijuana, these habits contribute greatly towards high cholesterol levels in the bloodstream that could eventually lead to ischemic heart disease. And that's it, guys. We hope you enjoyed this video. Please like and subscribe. Also, comment down below and let us know what types of topics you'd like more videos on. Until then, stay safe and stay positive.